listening to 40 Weeks, a production of the Pregnancy Podcast with Vanessa Merton. Visit pregnancypodcast.com/week for all of the 40 Weeks resources and sign up with your due date to get each episode delivered to your inbox when you start a new week of your pregnancy. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 40. Your due date is finally here, so congratulations, you're almost there. See a picture of what your baby looks like this week, read the transcript, and access the additional resources for week 40 at pregnancypodcast.com/week 40. Your baby was about the size of a honeydew last week, and this week they're the size of a small pumpkin. Your baby measures almost 20.1 inches or 51 centimeters and weighs about 8 pounds or 3.6 kilograms. As a baby is squeezed through the birth canal in a vaginal birth, its head can get a cone-like shape. If this happens to your baby, please do not panic. This is temporary, and their head will go back to being perfectly round and normal shortly after birth. Some parents choose to put a cute hat on their newborn just to hide that their head may be a little misshapen from birth, and that's always an option. Also, when your baby's born, they can only focus their eyes about an inch away, but they will recognize your voice immediately. So all of that talking that you do during pregnancy will pay off, and your baby should recognize and be comforted by you and your partner's voices. If you go over your due date, appointments may be more often and can be every few days. Take advantage of the additional FaceTime with your doctor or midwife to ask any last-minute questions about labor and birth. This week is a good reminder that your due date estimates when your baby will arrive, but it is not an exact science. And it's definitely not a deadline. Most estimates on how many babies are born on their due date range between 3 to 5%. According to CDC data, 57% of babies are born full term between 39 weeks and 40 weeks, 6 days, and just 5.13% are born after 41 weeks. Although many mothers go past their due date, it can still be frustrating. There's a lot of rumors about things that you can do or food that you can eat to induce labor naturally. Some of these are methods that have science behind them. Others are old wives' tales that you can probably skip. And a few of these methods actually carry risks. There's an episode of the Pregnancy Podcast that examines the evidence behind all the methods thought to induce labor naturally, including exercise, baths, nipple stimulation, sex, acupuncture, castor oil, evening primrose oil, spicy foods, pineapple, dates, and more. You can check out that episode at pregnancypodcast.com/inducing labor naturally. Tip for dads and partners, speaking of inducing labor naturally, if you ever needed an excuse to shack up with your significant other, you have a good one this week. A few mechanisms at work make sex a tool for naturally inducing labor. So getting intimate and having an orgasm promotes the release of oxytocin, which is the hormone that causes contractions. Female orgasms also include uterine contractions. Plus, prostaglandins are highly concentrated in semen, and prostaglandins cause the cervix to ripen and uterine muscles to contract. In fact, some of the medications used to induce labor use synthetic prostaglandins. The evidence to support having sex to initiate labor is mixed. You may need to modify positions to accommodate your wife or girlfriend's belly, but there's no downside as long as you both are comfortable and having fun. And if you or your significant other have any concerns or questions about having sex during pregnancy, please bring it up with your doctor or midwife. Thank you for tuning in to the 40 Weeks podcast. You can see the full transcript and all of the resources for this episode at pregnancypodcast.com/week 40. Next week, if you still haven't gone into labor, your baby just needs a little more time. Until then, I wish you the very best in your pregnancy journey.